COVID-19 has had a huge impact on the healthcare industry. We all know that. But it's not just because hospitals and doctors and nurses have been focused on caring for COVID-19 patients. The Locke Foundation's healthcare policy analyst, Jordan Roberts, has taken a look at what he calls the supply and demand shocks on both hospitals and doctors and other practitioners. And he's also looking at what it could mean for each of us in a post-COVID-19 world. Jordan joins me now to give us a sense of where we're heading. Jordan, welcome back to the show.
Thanks for having me.
So in terms of hospitals, we've heard so much media coverage of, do we have enough hospital beds? Do we have enough intensive care beds? Do we have enough ventilators and first responders out there trying to care for people who unfortunately have been stricken with COVID-19? But you took a look at something a little bit different, a little bit more 30,000-foot approach, so to speak. What did you find?
Right. So, what we have to remember here is that COVID's going to affect different parts of the country in different ways. But when we look at the data nationally, what we see is that there was a decline in revenue and of discharges among hospitals across the whole country. And the studies that I looked at the month of March in this year compared to last year to try to get this data. And what they found was there was consistent decline in revenue and utilization, but it was most profound in the third week of March, right when all the stay-at-home orders and, really when people started to take this thing as seriously, as we are now. And so that's where we see this initial shock of just complete, devastating drop in utilization and revenue for these hospitals.
And Jordan, that seems to me that, at least for me, it's counterintuitive because I'm thinking, all right, our hospitals are inundated with COVID-19 patients, but you're saying utilization was actually down?
Correct.
And revenue was down? How's that possible?
Well, like I said, it's going to affect different parts of the country in different ways, but nationally, when we look across, on the whole, it was down. So while some more hotspot areas would have, a much different experience in their hospital, they may be filled up, but, hospitals just 100 miles away may not have that same experience. So, just trying to get a picture of the entire country nationally, utilization and revenue is down for large hospitals.
Hopefully, of course, we will make it through and see a decline in cases and deaths and some of that we're already seeing. But once we get through this, tell us what you believe will be the impact overall on people who are trying to access hospitals and doctors and the system itself.
Yeah, so what I think about is some of these smaller rural hospitals across the country and in North Carolina where, they were told to cancel elective surgeries and all of their, potential patients in the area were told to stay home and not go access care. And, situations like that, they really didn't see an influx of of a lot of COVID-19 cases. And, therefore they had a much different experience than, say, a hospital in New York City. And so, what that does is they were, may not have had to cancel all those elective procedures and lost out on a ton of valuable revenue. And then that puts them, depending on what kind of federal aid they got from the CARES Act or things like that, that puts them in a really precarious spot going forward. And so what we see a lot is healthcare already has a merger and acquisition issue with large hospitals buying up specialty practices, smaller hospitals merging among themselves. And when that happens, patients usually end up paying higher prices and quality can be worse in these hospital systems. And so as more and more hospitals, small hospitals, lose revenue because of some of the decisions made trying to react to the COVID pandemic, they may be more susceptible to be bought up by large hospitals, and that we could see even further consolidation because of this. And that's a real issue for patients and all of us who pay for these higher healthcare prices.
What a sad irony that is, because essentially we kind of cleared the decks when it came to hospitals. Said everybody, unless it's an emergency, stay away. We've got to deal with the pandemic. But the reality of that is that a hospital has to make money. Doctors and medical professionals have to make money. Are they potentially looking at a bunch of pent-up demand for things that weren't emergencies? I mean, could that help them once people get the okay and go back to the hospital?
I think there's a possibility, but what I'd say in the paper is, this is looking at March and April, which were two of the early
months.
Right, and so we're going to have to look at the data, and this is going to be studied for a long time, the effect. But I think it's very likely that as hospitals open back up, there will be a lot of pent up demand, but that it might coincide with more COVID cases in the area, so we just don't know how it's gonna play out. But it could be devastating for a lot of these smaller practices.
I have a couple of registered nurses in my extended family in another part of the country, and I was shocked, frankly, to find out that both of them, at different points in the last several months, were essentially laid off.
Right.
Because as my niece told me, my part of the hospital really isn't functioning anymore, and I don't think people understand that.
No, it's an interesting, really just counterintuitive paradox that we clear out all this space, but in places where there wasn't a huge influx of COVID patients, they were laying off the very the frontline healthcare workers that we are placing so high to protect us from this virus. So like I said, it plays out different in different parts of the country, but it's really sometimes just counterintuitive to think about the effect that it's had in certain areas.
Some folks may not realize that their doctor may be actually a small business owner, may own a practice, and maybe it's one doctor, 3 doctors, etc., and they have a small staff, and so that's a business that they are in. And if they have essentially been put out of business because of COVID-19, then you kind of wonder what the future is. And I guess that ties into your argument about consolidation. Everything's just going to be kind of wrapped up into giant hospital systems?
Right, and that's what we see, the same data, in these other specialty practices like pediatric care, orthopedic surgeons, oral surgeons, dermatologists. Some of these practices that tend to be more independent and have been independent from large hospital chains in the past, they in March and April they saw declines of 70-80% of revenue and 70-80% of utilization, and that is just an incredible hit to their business. But also something else I talk about in the piece is with so much less utilization, that can have serious implications for health outcomes in the future. Things like primary care, orthopedics, oral surgeons, things like this, where a patient would go in to get an ailment or something treated that they push off. It might be even more expensive and be worse for their health in the future. So that's another reason. And like you said, there may be more pent-up demand, but it could be that all these procedures that we put off may end up costing a lot more. So while we have more demand, we're also spending a lot more on healthcare when we may not have had to with all of these closures and with such a steep drop in utilization.
So you looked at data comparing again March and April of this year to March of last year.
Correct.
Right.
Correct.
And so there's got to be just such a huge differential
it's
there.
Insane.